Hi everybody, Dr. Scott Taylor here from southwestspinerehab in Mesa, Arizona. I have Chelsea joining me today. We're going to show and demonstrate to you a technique called spinal mobilization. So we like to use this technique in our clinic for patients that a couple different reasons. One is, let's say you have an acute injury and you're not able to handle the force of a traditional diversified adjustment. Or let's say maybe you have osteoporosis or osteopenia or thinning of the bones. Or maybe you have just an injury that you're not able to fully move. And so I'm going to just briefly demonstrate this more gentle, softer technique for folks that maybe can't tolerate a traditional hands-on or diversified adjustment technique. So I'm going to have Chelsea, we're going to have you lie down on your back here for me. Let's go on your back. Sorry, we'll flip you over here. So Chelsea actually has a little bit of a hip issue. And so one of the things that we customarily do is to get that hip moving again, we will mobilize the joint. And so for her specifically, what we're going to do is we're just going to add a little traction and rotation. And so as we get to a certain point with her, it doesn't want to move anymore. So we're just slowly going to work that joint. And you'll see as we do a little bit more, it'll start to get more range of motion for her. This combined with different exercises and stretches, so we already are getting a lot more range of motion just after a few seconds. But this combined with different exercises and stretches will give the patient a lot more relief and a lot more range of motion. Now, a lot of patients have questions about getting their neck adjusted. So a technique there's a couple different words for it, but we're just going to utilize the term cervical mobilization, but we're going to drop this headrest down a little bit. And all we're going to do is mobilize this cervical spine. So Chelsea has a lot of upper cervical or upper neck tightness right at the base of her skull. And so we're going to just slowly mobilize that joint. Now Chelsea's pretty young, so her joints move really well, even though they're restricted a little bit. And so we will rock or mobilize them back and forth. And then we'll start to add some different motions, like this figure 8 motion to the upper neck. And it feels really good. But most people that are really struggling with this area, it's not going to move this much. It gets really restricted. But after a couple of rounds of it, we'll start to feel this spine moving more. It's a very relaxing technique for the upper neck that works very, very well. And then lastly, a lot of folks struggle with shoulder injuries. Now, Chelsea's left shoulder, she has some discomfort there, but I'm just for demonstration purposes, I'll show you here. Just similar like we did with the hip, we can do the same thing for the shoulder, but let's actually just use the side that's bothering her a little bit. And so we're going to do different techniques or different motions to mobilize that joint. You doing okay with this one? Okay, if it's too much, you got to let me know. Even the folks that demonstrate sometimes have some issues, so we got to be careful. And so we're just going to put her through some different ranges of motion here to get that joint more moving how it should. And so there's a couple different other techniques that we would use for the shoulder specifically. It's kind of dependent upon what you actually have going on in that region. But again, just in general, this is something that we utilize for folks that maybe can't tolerate a traditional diversified adjustment. Maybe they have an acute injury, or when you first come into the clinic, you can't tolerate a lot of forceful motions. Again, if you have any other questions, let us know and have a wonderful day.